What if the pill you take for heartburn each morning was quietly damaging your kidneys even when you feel fine?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. Heartburn drugs called proton pump inhibitors are marketed as simple fixes, yet the research shows long-term use can injure your kidneys, drain key nutrients, and disrupt cellular energy. I'm Ethan Foster, and today we're laying out what the science shows about PPIs, why reflux is often a low-acid problem, and how you can step down safely.
I'm Alara Sky. We'll walk through evidence linking chronic PPI use to both sudden and silent kidney injury, why standard labs can miss early damage, and safer steps you can use while you rebuild healthy stomach acid production.
Heartburn relief is common, but PPIs were designed for short bursts, not years. A review of studies from 2013 to 2023 found people on PPIs long-term faced higher risk of chronic kidney disease, with many prescriptions written without solid justification. The same analysis highlighted acute immune-driven kidney inflammation as a frequent trigger that can progress to scarring and atrophy if the drug continues.
Another large investigation compared PPI users to people on H2 blockers over 5 years and found a 19% to 30% higher risk of chronic kidney disease or end-stage renal disease among PPI users, even when anyone with an acute kidney injury was removed from the data. That means damage can accumulate quietly. You might feel fine while filtration capacity declines in the background.
Long-term acid suppression doesn't stop at kidneys. It reduces magnesium absorption and, over months, can lower potassium and vitamin B12 as well. That pattern explains fatigue, irregular heartbeats, tingling, or numbness some users develop. After a year or more, fracture risk rises because low acid impairs mineral absorption and enzyme activation needed for bone strength.
A broader medical review connected extended PPI use with infections such as C. difficile and pneumonia, nutrient deficiencies, rebound acid overproduction, possible heart problems, and several cancers in some studies. The FDA has flagged infection and fracture risks, reinforcing that the safety concerns aren't theoretical when acid is shut off for too long.
Here's the part that surprises many listeners. Reflux is often driven by too little stomach acid, not too much. Your lower esophageal sphincter is pH sensitive. It closes properly only when gastric acidity reaches the correct range. If acid is low, the valve doesn't seal tightly, and food and acid drift upward. Aging, autoimmune issues, H. pylori, and weak mitochondrial energy all push acid levels lower.
Mitochondria power the acid-producing cells in your stomach. When cellular energy lags, acid production slows, digestion stalls, and reflux worsens. That's why addressing energy production, sleep, sunlight, movement, and nutrient-dense real food fits alongside targeted steps to restore acid, rather than relying indefinitely on acid blockers.
If you're currently on a PPI, abrupt stopping is a mistake. Rebound gastrin can spike acid and symptoms. Taper slowly with your physician over 2 to 3 weeks to the lowest dose you can tolerate, then transition to an H2 blocker. From there, taper the H2 blocker over several weeks until you no longer need it.
For short-term relief during that step-down, famotidine, Pepcid, stands out. It provides acid control without the long-term safety concerns tied to PPIs or older H2 blockers. Ranitidine was recalled. The over-the-counter Zantac 360 degrees now contains the same active ingredient as Pepcid, so there's no advantage in choosing it over the original famotidine product.
There's also a systemic angle to famotidine that matters. Excess serotonin signaling can promote inflammation and mitochondrial dysfunction. Famotidine helps rebalance that activity while providing symptom relief, which is why it's the H2 blocker recommended here over options like cimetidine that carry more interactions and side effects.
As you move away from acid suppression, supply the raw materials your stomach needs to make hydrochloric acid. Prioritize hydrogen-rich foods, fresh fruits, vegetables, and proteins, and chloride-rich foods such as natural sea salt, tomatoes, celery, lettuce, and olives. These give you substrate to restore normal acidity, so the esophageal valve can close and digestion can proceed downward.
Strengthen mitochondrial energy to support acid-producing cells. Daily sunlight, consistent sleep, and real food are pillars. Eliminate seed oils rich in linoleic acid, common in canola, soybean, sunflower, safflower, grapeseed, because they impair energy production and slow digestive recovery. As energy improves, acid production and motility follow.
Layer in time-tested digestive supports. Bitters before meals cue your system to initiate acid release. If acid is already very low, use betaine HCl. Start with 1 capsule before meals and increase gradually until you feel warmth or mild discomfort. Then back off slightly and hold at that dose. Another option is 1 tablespoon of raw, unfiltered apple cider vinegar, diluted in a full glass of water just before or after a meal.
Expect your symptoms to shift as you taper. Early on, you might notice brief surges of acidity. This is rebound. That's why the gradual step down to famotidine, then a measured taper, is essential. Meanwhile, the substrate and energy steps we outlined work in the background to re-establish steady, natural acid levels.
If you've been on PPIs for months or years, schedule a review with your clinician to reassess the original reason, confirm whether continued use is necessary, and plan a taper. Ask about monitoring magnesium and B12 during and after the transition. If you're older or take multiple medications, be especially proactive, because the risk of adverse effects rises in those groups.
Your challenge today is simple and specific. If you're on a PPI, write down your current dose and duration, then book a visit to discuss a 2 to 3 week taper onto famotidine, followed by a gradual taper off. At home, replace seed oils with whole food fats, include chloride-rich foods at each meal, and add either bitters, betaine, HCl, or diluted apple cider vinegar before your largest meal to support the transition. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.